I'm Eve Lyon, Recovery Navigator for CareerSource Research Coast. Welcome to St. Lucie Recovery Works, an initiative supported by the Florida Department of Economic Opportunity. In an effort to connect the social service and treatment service providers and the judicial and law enforcement systems to the workforce development community, I invite guests each month for conversations on prevention, treatment, and recovery to highlight the resources and success stories that demonstrate recovery is possible. Our ultimate goal is to improve outcomes for people with substance use disorder, a condition that affects millions of people across the globe, people from all walks of life. Employment provides important structure as well as meaningful purpose for all people. For people in recovery, employment supports long-term recovery associated with better quality of life, greater self-esteem, and happiness. Please remember that 3 out of 4 people who experience substance use disorder will recover. CareerSource Research Coast offers valuable tools for both job seekers and employers. Employers are supported with hiring and training. Job seekers can explore in-demand career opportunities and receive support with job search, job readiness training, and for those resources, please visit careersourcerc.com. That's careersourcerc.com to access those resources. It is my understanding that unless you are a child, pregnant, disabled, or a senior, you're not eligible for Medicaid in Florida. The modern concept of a free clinic originated in Haight-Ashbury in 1967. From there, free clinics spread to other California cities and then across the United States. In 2001, the National Association of Free and Charitable Clinics was founded in Washington, D.C. Free clinics are defined as safety net healthcare organizations that utilize a volunteer staff model to provide a range of medical, dental, pharmacy, vision, and/or behavioral health services to economically disadvantaged individuals. We are blessed to have a very comprehensive clinic in St. Lucie County. My first guest is Lisa Hatch, Executive Director of the Hands of St. Lucie. Lisa joined the clinic in 2020 during the pandemic and has already built significant collaborations and alliances in the community to increase access to healthcare resources for low-income, uninsured, ages 19 to 64. Lisa, thank you for joining us this evening to discuss the very important and potentially life-saving medical services provided by the Hands Clinic. I understand the clinic is the only free and charitable clinic in St. Lucie County.
Absolutely. Thank you so much for having me. Our clinic started in 2010 when a group of concerned citizens got together and realized that either A, an individual will not qualify for Medicaid, or B, they can't afford the Affordable Care Act.
Right.
So the work that we do is 100% free. We provide over $11 million in services per year to the community and the people who receive our services. We give out approximately $500,000 worth of medications every single month, and we're there to meet every one of a patient's needs.
So can you review some of the services that actually are provided?
Absolutely. So when you come to our clinic, you have to picture it like you're taking your car to a mechanic. So we're going to look at you and work with you anything that's wrong bumper to bumper. Now, occasionally you need to send your car out to get the transmission repaired. So we will make those contacts and connections, get you into a local provider, hospital, or other volunteers to help you take care of it. But in-house, right in our brick and mortar location, we have primary, women's health services, we have prevention and education, birth control, we have a full dental clinic, we have everything from dermatology to podiatry, any problem that you have. And if you come into my clinic, we're going to make sure we do our best to treat you.
And you have vision, and then you have resources for mental health counseling as well, right?
We have vision, and we're working on building our mental health program.
Okay.
Mental health is probably one of the most challenging issues in this community. But we do make referrals, and we do have partnerships outside of our clinic. So, for example, when an individual comes to us with a chemical dependency issue, we have a business arrangement with Pinnacle Wellness. That's where we get them. They get absolutely wonderful care. We also work with New Horizons to try to get individuals in for their services. We won't leave you hanging.
And did you say something about smoking cessation
classes
as well?
Yes. We have smoking cessation.
Okay.
So one of the things that drives me crazy in the clinic is I'm filling prescriptions for like 4 and 5 inhalers, and the person goes outside and smokes a cigarette.
Right.
So I'm like, hey man, come on, quit smoking. Take that off my plate.
So your services are very comprehensive, and how are you able to provide such a wide offering of services?
The generosity of this community, the desire of physicians to want to practice and volunteer their time So I have approximately 60 volunteer physicians,
That is-
which includes 5 GYNs, 16 dentists. I also utilize medical students from the local colleges because we want them to come in and meet our patients and help them live their best life. It's absolutely fantastic component of their education. And of course, I get a lot of support, and I'm very grateful to the county. They help us with funding.
Excellent.
I also work closely with the Florida Association of Free and Charitable Clinics. Those groups help us keep the lights on.
Great. And that collaboration with all of the practitioners in the community to come in and volunteer their time is just really, truly amazing and admirable. So how does someone qualify for service, and then what is the process for that to happen?
Well, the first step is just calling the clinic, okay? So basically, and I will get the information up for you. I'm sorry, I forgot to bring my card with me. But all you have to do is call. So you have to be between the ages of 19 and 64, 100% uninsured, St. Lucie County resident, and 200% below the poverty level. That means a single individual can make up to $27,000 per year and qualify for my service. And it goes up from there. I have individuals who work with patients. They're called navigators. They will help you gather the data I need, or the information. So for example, I'm going to need to see your driver's license. I need to see your social security card. I need to see 4 paycheck stubs. But here's the thing. If you don't have your driver's license, don't not reach out.
Right.
I'm going to teach you how to get your driver's
someone
license.
should call, and they'll be guided on what the process is. So that's
Absolutely.
772-462-5646.
Thank you so much.
And your address is 3855 US 1, and that's Fort Pierce, right?
That's Fort Pierce, but we do see people from both Fort Pierce and Port St. Lucie. And for people who've been in this community longer than me, we call it the old Sam's Club. And I always joke that it sometimes still smells like muffins.
Makes you hungry, right?
Uh-huh.
So September is National Recovery Month. And if someone comes to the clinic in search of support for substance use disorder, we did talk about the fact that you would refer them out.
Yes.
And so we just want to reiterify that there are resources available, and that Lisa and her group does have access to many connections for support in those areas.
And I'll tell you, I just want to chime in here and say, I've met multiple people who've come to our clinic in probably the roughest shape you've ever seen, and they are completely new individuals today.
Yep.
So proud of every single one of them.
We know it's possible.
The
Absolutely.
partnership between the Hands Clinic and Pinnacle Wellness has just been such an incredible success.
Yeah, we've had actually in other sessions, Dr. Palestrand has been a guest on this show. So
He's kind of a rock star around here.
Oh, yeah. So stigma sometimes prevents someone from seeking help. What is your advice about asking for help?
You know what I love most about healthcare is that, you know what, we're all going to go through it.
Yes.
When you are not well and you are not feeling well, you are not unique. The hard part is to admit that you're vulnerable, because we all want to think that we're superstars and rock stars.
Mm-hmm.
And, but quite frankly, I have been in that situation in the past. People often occasionally ask me, who is your typical patient? And I always say me, because I got divorced in New York. I moved down here. I didn't have a steady income, and I qualified for the services of the Hands Clinic. And you know what? I was stubborn. And I let my ego get in front of me, and I did not reach out. And guess what? When I found out that I was allergic to fire ants, I was in the hospital because I couldn't afford $478 for an EpiPen. So that ultimately ended up costing me $20,000. Don't think that you're Superman, and don't be afraid to reach out. And quite frankly, at the clinic, I'm really proud of the fact that we love all.
Are there people with different language capabilities to help if somebody's language is not, if their first language is not English?
Absolutely, absolutely. And sometimes for the more challenging, so our Portuguese population around here is increasing rapidly. I just found this out. Many times somebody will bring a family member to help translate.
Oh, that's a great idea.
So there's a million different ways. Any obstacle you think you have, let me help you move it.
And I know recently you talked about addressing the Haitian community as well, to let them know about the resources that are available.
And I've been having a lot of talks with them, and I'm going to join the Haitian Chamber of Commerce. We just recently made an investment in our women's health services. Currently, there is a lack of providers in this area. We want to focus on prevention and education, but we also have all the equipment. Thank you, Cleveland Clinic. We can address the abnormal cell. So the next closest place where a woman can have this service for free is West Palm Beach. So plus we have really close relationships with Cleveland Clinic. So I want the Haitian community to have access to all those services. I'm trying to save women's lives, and I'm trying to give them the power to choose when they want to have a baby.
And so we talked about where you're located. Is there public transportation to get to 3855 US 1 in Fort Pierce?
Yes, there is. And quite frankly, through Crisis Services, which was an absolute phenomenal partner, they can help arrange for transportation. And when hard pressed, and in some situations, I have paid an Uber to get people back and forth. Okay. Don't let transportation be your obstacle. And quite frankly, I'm at a mobile unit, which is starting up soon. And so we're going to take primary care right down into the areas that have the hardest time with transportation due to lack of bus stops, et cetera, et cetera.
That's very exciting.
It is really neat.
So we talked about medical, but do you partner with other community-based organizations?
Yes, I have some really amazing partners. When I need an employee, I call CareerSource.
Okay, thank you.
Hey, when I have a patient who comes to me and they have no food, I call Mustard Seed, Treasure Coast Food Bank.
Stacey.
We work closely with we work closely with Crisis Services. Quite frankly, sometimes on the surface, and when I first got here, it didn't look like we had a safety net here, but we've got some seriously strong people fighting for those who need a little extra help.
We do, and that goes back to, that stigma. Don't be afraid to ask for help, because there are so many resources in our community. That's their mission. That's their purpose, is to put a hand out and to help you. So yes, if
I always tell people, and I promise people, I tell people all the time, if you reach out today, if you just swallow your ego and reach out today, 1 year from now, you're not even going to remember what this issue was.
Your life will be very different. So I'm aware that you're advocating for introducing the enhanced services that would let the community know about. So we were talking about women's health and dental care. Those are two new initiatives that you're trying to beef up?
Yes. Well, women's health, like I said, I just pretty much built the whole surgical suite. Okay. I have 5 volunteer GYNs, 2 doctoral nurse practitioners that are focusing strictly on women's health issues. If you receive a pap smear and you have an abnormal cell, we can manage that and take care of it 99% of the time right in the office. As far as dental, we signed a partnership with Nova University.
Oh.
So we've always had a dental clinic, but it's very difficult to get it staffed. So normally we have 1 day of dental per week, and we move that day. We do about 30 appointments. But with this model and this partnership with Nova University, they send residents up. So I have 16 volunteer dentists ready to supervise residents, which means I can activate between 2 and 3 rooms, which that's probably healthcare lingo jingo.
Right.
But basically, I should be able to do at least 50 appointments a week.
Amazing. But it's so important to a person's image, their ego.
Ego. I don't just remove the teeth. I'll help you get your dentures back, okay?
Yes.
And on top of that, if you ignore dental pain and dental care, you can't ignore it for long. You will end up developing an infection. It could lead to endocarditis, which is cardiac disease. You have to address your teeth.
Right.
But we're not just going to tear them all out. We're going to give you options to get them put back in.
Okay, I love that.
Yeah, my patients look like rock stars around here. Healthcare is kind of a cool industry to be in because we take people at the place they're at. That's it.
It's pretty cool to walk through the facility and see how comprehensive it is. And it's like walking into a mini medical center, really. There's rooms for everything and every kind of treatment. So I do encourage people to take advantage. That's the Hands Clinic, 772-462-5646. And I always put my own contact, Lyon. It's ELYON at careersourcerc.com. If you missed any of the contact information we talked about, please reach out to me personally, and I'm always happy to connect people to any resources that you might be looking for in the community, whether it be medical, mental health, substance use, treatment. Lisa, thank you so much for all of this important information and for the services that you provide to the most needy in our community.
Hey, I appreciate you guys having us. Thank you so very much.
The Centers for Disease Control and Prevention estimated there were 108,642,000 drug overdose deaths in the United States during the 12-month period ending in April of 2022. More than 3 out of 5 overdose deaths had at least one potential opportunity to link people to care before the fatal overdose occurred. Many sectors play a role in contributing solutions. My next guest promotes harm reduction through his organization, the Harm Reduction Center. Kevin Choi is their CEO. Kevin, thank you for joining us this evening to discuss the very important topic of harm reduction. I know your philosophy is to encourage everyone to to remember that no one individual is more or less deserving of a chance at happiness and a chance at fulfillment. And I love that message. Can you please explain your interpretation of what harm reduction is?
Thanks for having me, Eve. And I think harm reduction in theory is meeting somebody where they are, and no matter what your thoughts about where they are might be.
Okay.
And that can be tricky at times because you're talking about the healthcare space, and there's a ton of diagnosing that goes on and things that happen of right and wrong. But at the end of the day, a lot of these ailments are a large burden onto not just the individual, but the folks around them. And so the idea is to meet them where they are and do what we can to reduce the harm that's caused by these life situations.
Okay, so it could be medical, it could be mental health.
Yeah, I think this is like a philosophy that should be carried throughout healthcare in general, but and more specifically in substance use disorder, it does mean a lot more prevention work, allowing for clean needle exchanges, even clean injection sites and things like that. How we view it is to integrate it into the actual healthcare system and the healthcare models.
Okay.
Yeah.
So what is the actual work of the Harm Reduction Center?
So what we do is we focus our efforts on the low barrier, lower cost servicing for mental health and substance use disorder treatment, which means that it's generally outside the setting of a hospital. So it's outpatient based. We focused on getting licensed by DCF and ACA. So we see both mental health cases, substance use disorder cases. High percentage of folks deal with both. And so you should be kind of tailoring a program towards both.
Okay, so that is including medically assisted treatment.
Our entire basis of starting out was non-traditional health treatment. So we saw the treatment model in South Florida, what it looked like, what it did. We really just wanted to kind of stray away from all of that and start out kind of branding ourselves as, hey, we do not care about your traditional thoughts about what mental health or substance use disorders might be. We're here to just help the individual kind of find a path that works for them.
Okay, so that could include outpatient, as you said, but also just family support.
Family therapy, it could be group therapy, it could be somebody coming in once a month, it could be somebody coming in 6 days a week. It really just depends on the individual, their needs, where they are in life, their life situations, everything that's important to them, we also need to take into account.
So that is, what my next question was going to be is what makes the Harm Reduction Center different from other treatment options. So it's that philosophy that really allows the individual to sort of drive their own process in a way, right?
Yeah, and just being available to them. So not limiting ourselves to singularized locations and getting really beefy in one location, kind of being willing to be uncomfortable and mobile, so going to other places, and hence our kind of transition to this area.
And how did you get involved in this work?
It's all personal.
Okay, let's hear it.
It's all personal, I struggled with mental health and substance use disorder issues myself, and I knew that this was eventually going to be a part of my life in profession. I was like, I want to do this and help folks and see what I can do in kind of a mixing business and also mixing my own personal passions. Back in 2014 is when I came down here and ultimately, got straight and got my stuff together. I started working in the field, and then my father and I decided, hey, let's take some family money and try to do something, try to do something different.
I mean, we talked about stigma, and I know your family background.
It's very, I'm a Korean American, and in our family structures, this really isn't stuff that's talked about. I know it's in the family, don't get me wrong.
Right.
It's in every family. It's
Yeah.
everywhere,
Right.
But the willingness to speak about it, the willingness to have conversations and have an understanding of what actual care and treatment of these issues looks like was not kind of explored much, and so we came in blind. So many families come in blind, and what ends up happening is, there are areas for manipulation for the folks who are actively in those situations, and families don't know what's going on. They're being taken advantage of, and there's a ton of harm that's caused in this world. And I know this because I've caused said harm.
Right.
I know the extent of which human beings can go And it's something I hope that others kind of view as, okay, I am important, I am valuable. Look at the actions that I have done and the effect it's had. Even though it's been negative, it should show you that maybe through positive actions and kind of good work and deed and virtue, hopefully the end product is just as big, just as good, but not awful.
Right.
The other flip side of the coin.
And that's why I invite people like you to come in and tell your stories, because, I mean, your story started because of a sports accident, right?
Yeah, it was a 10th grade. I ended up getting tackled and, I put my arm out, compound fracture elbow, and then, go home after the hospital, and then first time taking a Vicodin. And then that's when I really realized, oh, you can take stuff to sleep, you can take stuff to change how you feel. Yeah, and it made you feel superhuman. There's stuff out there that's going to make you not feel like this,
And you had multiple attempts at treatment, right?
Mm-hmm. And multiple attempts. I mean, I've had, I think, 5 treatment attempts, but there was a point in there where, I costed health plans in our community a ton of dollars. I had 7 overdoses in 18-month periods. So think about the EMS, think about the bills that came in, think about, because they could have probably been helping somebody else out there in that time too.
Yes.
Not that I wasn't worth saving or anything like that, but there were just times in my life where things were incredibly messy, and that's also kind of the point of reducing the harm and kind of that's created in one's life.
Well, and now here you are, CEO of an organization that is helping to solve the problem, really. Providing these really sorely needed resources in our community. So kudos to you. It's just really great. And I know there were times, you say that, you're clear that you were alone and you didn't have that safety net. You didn't have that handout. You really didn't know how to navigate the system or get that help and support that you needed. So it's great that you're really providing that now. And I know that you were initially in Palm Beach County, and now you're here on the Treasure Coast. So what's that all about?
We're working with a hospital organization called HCA. What we're trying to do with them is kind of beef up this program. They're really the only hospital organization that's currently continually investing dollars to build behavioral health beds out, to continue to do this work. A lot of large hospital groups have been kind of pulling beds back, either closing facilities down, and so we partnered with them to figure out a way to produce somewhat of a standardized level of care across 800 beds in Florida. Now, this is a many year project. It's going to take forever, but you got to start somewhere.
Correct.
So starting somewhere would have been Longwood Regional here.
Yes.
We're credentialing with their departments right now, and they're getting to know who we are, and that process. Healthcare administration takes a lot longer than I thought, and it costs a ton of money. I walked in here thinking, I'll get this done in 2 years. It's been 5 almost.
Okay. But you keep moving forward.
Exactly.
And you're making progress.
Exactly. And you just keep surviving and trying to make the next day happen and make sure that your goals and the needs of the folks around you are being met. And it's not the easiest battle, absolutely not.
So ultimately, what do you envision that it will look like when you have this successful collaboration?
Eventually, the successful collaboration will be what we would call continuity in care for those dealing with this issue, non-restrictive to insurance policy, non-restrictive to age, really anything. We're really doing our best.
So can you give a real life example? So somebody walks in or is transported to
Longwood. Let's say they go to Longwood Regional. Eventually what they'll see is one of our physicians in there doing the psychiatric evaluations. They'll then meet with this individual. Hopefully the goal is to have a peer with them and then a medical liaison with them, somebody to help coordinate their care, and then the peer there to ultimately be there with them. And through this time in life where, honestly, I remember when I was an inpatient, there was an individual there who had a 10-minute conversation that changed my life. Okay. And it was 10 minutes of just somebody taking the time to help me realize that I wasn't worth nothing, to drive value back into who I was. I want to cry thinking about this, but, and I ultimately thank that gentleman, Steve, for a ton, but folks who genuinely care and want to be connected and help folks out have the opportunity to actually do it. A lot of the barriers that are presented, a lot of it's due to healthcare administration. The admin part of this side is so complex and difficult. The United States healthcare system is incredibly complex, So creating a situation like this simplifies all that, at least in our mind.
Yeah, so here's somebody at their probably lowest point in their life, and then it's incomprehensible to have to navigate the
all
whole
that by yourself,
financial,
and
administrative,
exactly.
all of that. Yeah,
And tell
even
them,
just an ID. Sometimes somebody just doesn't even have an ID.
And that'll be the reason why they don't go seek services.
Right.
It's because they have to go. There's 6 other steps involved now to get to this care. And the thing is, getting them straight to the care and then dealing with it is probably a better way to do it. And supporting them with case management and intensive case management servicing is absolutely necessary.
And that lived experience pair that you talked about, I think that's the secret sauce. Honestly, I know we met yesterday with Barbara Moody Holbrook at Right Life Services and their recovery community organization here in Port St. Lucie, and that's what they're all about. And when you walk through the door of a recovery community organization, the first thing they say is, we just want to love you. We don't care where you've been, who you are, or what's going on with you in this moment. We just want to love you. We want to support you. We want you to know that you have value, and we'll help you figure the rest of the stuff out.
And that's very simple things to say to somebody who's in probably the worst times of their life.
Right.
But it is incredibly encouraging to hear those words and have people in front of you being able to help you and do something about it.
So you must have many successful outcome stories, but is there one in particular that motivates you to continue sharing the message that recovery is possible?
Yes, I was thinking about this. You asked this. You told me to think about this case. There was a lady. She came in. We had just gotten our ACA license. So,
do you want to explain what that is? Not
so
everybody
in the
knows
state
what
of
ACA.
Florida, the licensing for behavioral health provider organizations happens through the Department of Children and Family Services for substance use disorders and the Agency for Healthcare Administration for the mental health side.
Right, and that's what ACA is.
And that's what ACA is. And so we got our ACA license. It took a very long time to get that. And so we were so excited, and we staffed up a staff psychiatrist. We had a therapist dedicated to this, a case manager, and a ARNP. And we started this program, and she was really the first one in. She hasn't left in the sense of she's continued her care. It's been 3 years. She came from a situation where she was Baker acted on the verge of suicide.
Okay.
So you're talking about somebody's turnaround and watching them maintain that turnaround. So it's not like we did anything after
they did the
that.
work.
They did the work.
Yep.
She showed up for her stuff. She showed up when she needed to. When things got hard, she reached out and did the work. And so it made our jobs just easy. We just did our jobs, and it turns out that if we do our jobs and make ourselves available, and folks are willing to, link into those cases and that type of care, folks can maintain not going back into Baker Acts and on the verge of suicide, and just these intense life situations, can be avoided if, light servicing happens kind of throughout somebody's journey.
And the Baker Act, for those that don't know, is forced institutionalized for the protection of either the individual or if there's a possibility that they might be harming another individual. So that's a court order. So it's National Recovery Month, and we can't responsibly speak about treatment without bringing attention to the dangers for overdose that we just talked about in our community. Can you talk about the hidden risks associated with fentanyl?
Absolutely. I'm sure everybody nowadays,
No, you'd be surprised.
Just in case anybody hasn't heard, there's an illicit substance out there called fentanyl. It's measured in micrograms, and it's incredibly deadly. It's currently being put into and cut up into a lot of what's being sold out there
on the streets.
And I know folks are actively even going and seeking fentanyl, and that's the crazy thing about folks in this situation and predicament. They want the best stuff, and eventually the best stuff ends up killing them. So if you are in that situation, you're just not sure. I know there are fentanyl test strips that you can purchase. However, I think in the state of Florida, they just made it illegal for individuals to purchase. So you'd have to go into a medical facility and ask them, which probably won't happen.
Correct. Because just one pill can kill, and micrograms of fentanyl can kill.
Yep.
And when we talk about micrograms, those are a couple of crystals of salt.
1 kilogram of fentanyl, pure fentanyl, can eradicate about 500,000 people.
Correct. Yep. Very dangerous, and it's in everything. I mean, it's in things that look like candy and gummies.
Yeah, it's in pills that are being sold. They're being pressed into pretty much everything.
So we said that for someone to begin the process to access treatment, we want them to either go to the website harmreductioncenter.com or call 866-205 1382 866-205 1382. And if anybody is listening, I always want to promote 211. That is a community resource in every community. You can either dial 211 on your phone or you can go to 211.org. 211 is connected to a multitude of resources in the community. They do not provide service, but they will connect you to service. And if it's an emergency situation, they also have geographic locators. So providing you're calling from within a particular geographic region, you'll automatically receive immediate assistance. So you could call 911, but I recommend, if you're looking for resources, to call 211. So finances or lack of insurance should not prevent someone from seeking treatment. What resources are available?
So currently the state of Florida has dedicated, I think it's annually about $1.5 billion a year to this stuff. And it's distributed amongst the managing entities of Florida. So there are, I think, 6 or 7 of them in the state.
So a huge thank you to my guests, and thank you for listening. Please tune in next month at 7:30 on October 24th. That evening I will have victim advocates from the St. Lucie County Sheriff's Office to talk about their work in our community.